Pulled elbow in children is extremely common when we tend to pull them from one side, and especially when we hold them here or here, and that is something which is to be worried. Why? Because what happens exactly in that is that one of the bones which is there in the forearm, which is on this side, that bone has a covering, and that covering is just able to cover the head of that bone. That head of the bone is not fully developed, and that's why it partly comes out. That is called as partial dislocation or subluxation, and that's very painful for kids. And children, they stop moving that limb, and only thing what they do is they'll start only moving the hand, and we can give a key to them and make sure that they are moving this hand at least. And then we see that okay, they have just kept their hand like this and not moving, and it's painful, so they keep crying a lot, and you cannot counsel them. So that, and when you actually see the other hand and compare it, you'll see that there is not much swelling, but the child is not moving. Now this can be assumed that it can be a pulled elbow. You should immediately go to your pediatrician or the orthopedician, who will do a small maneuver which is called as handshake maneuver, which will help to get this radial head, which has partly come out of that capsule, to go back. And in the same way, now there are two other things which can happen. Now this same thing with all the same scenarios and child not moving, and when we see the other hand and compare this, within half an hour or within 20 minutes to half an hour, if there is a swelling here, a big swelling or redness, then more likely that this is a fracture. So you have to be even more careful and make sure that child doesn't move or nothing touches this part of the hand, so that there is no movement which will dislodge the parts of the fracture. And you should immediately go to the pediatrician or orthopedician and get what the actual treatment done. The third part which can happen is not the dislocation or fracture here, but at here, that is at the shoulder level. Now this can happen with a lot of force. Now this is rare. Now what is lot of force is when the child is holding like this, and child is holding on to something at the back, and then we are rushing somewhere and we try to pull this as well, and child tries to pull this as well. So that in that case there can be a dislocation of the shoulder as well. Now that is visible deformity. You can see that there is a drooping, and then there is an abnormal way how this shoulder looks than this. So that again, you have to quickly go to the pediatrician and the orthopedician and get that fixed. Thank you.